Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
News at 10 has uncovered evidence that many mental health care trusts in England are cutting beds despite being promised £1 billion in extra government funding. More than half the trusts which answered our Freedom of Information request admitted they had reduced the number of beds available for patients with mental health needs. But far from channeling the resulting savings into community-based services, the cuts have meant that an already overstretched system is now left struggling to cope. The result is that people who urgently need an NHS bed are now being reduced to travelling hundreds of miles from home, with others turning to costly private hospitals.
I believe we can lead a revolution in mental health treatment in Britain.
We've increased by 5 times the number of people getting treatment for depression and anxiety.
A record level of investment in mental health.
They're promises that have come thick and fast. What's slower is any sign of the money getting through. When Ollie, who's bipolar, found himself in crisis, there was no bed available, so he was left overnight in a police cell.
The fear that I felt was just unbearable, so I just started punching the wall, and I split all my knuckles, and I was literally writing help in blood, because no one would come and help me.
We got in touch with all 58 mental health trusts in England. 32 replied. Of those, 60% said they had cut the number of beds, leading to a total loss of 230 beds this year from those trusts that responded. Yet they reported spending an average of £29 million on private beds when their own were full, sending patients up to 328 miles for treatment.
She was so happy there, wasn't she?
Stephen and Julia Hollings face a 5-hour drive to see their daughter, who's being treated in an eating disorder unit in Glasgow after a month-long search for a bed.
No beds, and it kept on coming out. And then eventually this one came as a potential to be available in Scotland. We would take anything, anywhere, because you do.
The former Deputy Prime Minister, whose party pushed hard to get mental health on the same footing as physical care, says it's a betrayal of the most vulnerable.
Well, I haven't, as it happens, spoken out much before, because I kind of accept you can't turn around a great tanker quickly. I know that as much as anybody else. But we're now a year and a half into a new government since the last general election, and not only is no progress being made, we're actually going backwards.
Hospitals are having to deal with all but impossible choices. With the NHS struggling to reduce its spiralling deficit, it's estimated 4 out of 10 mental health trusts had their budgets cut last year.
We all know actually that the NHS is in there's a series of fires going on elsewhere, and sometimes if you don't have a ring-fenced pot of money, it's pretty easy and tempting to use that money as a means to dampen the fire over there. But actually that shouldn't be the case.
The government has admitted emergency mental health care is inadequate and has a 5-year plan to put it right. But that's time those in need of help now simply don't have.
And Rachel joins me now in the studio. Rachel, many trusts simply aren't able to provide the beds now, but what's to say they'll be able to provide community care next year if they're in this position now?
Well, that is very much the plan, at least here in England, although it's worth saying that many other areas of the UK, patients are having the same problems trying to get help. But when we presented them with our investigation, NHS England said that they are investing £400 million next year in community crisis response teams as an alternative to hospital admissions. Now, while it's very laudable to get care closer to home, as all these families will tell you who've had to travel so many miles, what's important about that is they said next year, and what our figures show is that hospitals are cutting beds already before those teams are actually in place. And we don't know either whether the savings that they are making are then going to be put into those community-based teams, because one hospital told us very bluntly they're cutting beds simply because they don't have the money for them. Not surprising when the think tank, the King's Fund, reckons that 4 out of 10 mental health trusts had their budgets cut last year. It means with much of the government funding promised only coming through in the next 3 or 4 years, a quick resolution to this doesn't look likely.
It doesn't indeed. Rachel, thank you very much indeed for joining us.
I've been getting
away with